Okay, our next question is from Nadia Nad. Nadia, bless her heart, is trying to ask a question in English when it's obviously not her primary language. So Nadia, I'll try to answer that as best I can, trying to understand it. So the gist is that she has an agility border collie that when it was about a year and a half, 1.8 months, the TPLO was performed. 6 months later, the lameness didn't improve, and so the plate was taken out. She's now 3.5 years old, so another 18 months have passed approximately, 2.5 years. She's doing fine, and she's doing agility at quite a high level, but in the fall and in the spring, she wasn't using a foot, if I understand your question right. That's not related with dog agility, or a foot is slightly worse. I assume it's the foot that was involved with the TPLO. And she wants to know whether she should wait for further complications and what, how to know how to address them, and what supporting medications to recommend. Well, I'll tell you, there's a reason why there was a problem with that plate. And the question is she fully 100% back after having had the plate removed, even though it's been 2 years later? Or is there still something going on? I don't know if you have the availability to do physiotherapy in your area, Nadia, or whether you have somebody in the area who does chiropractic, but I would say definitely she needs to have her structure worked on, and you need to do some range of motion therapy with that particular leg. As in my article you saw, we have some instances sometimes where the screws will actually penetrate through, and that would be one thing I would look for. Penetrate through the bone on the other side, and we had one special case where that was that ultrasound where it was penetrating through far enough that it was actually the screws were sticking into the soft tissue of the cranial tibial muscle in between the tibia and the fibula, but it's muscle and there's nerve and a blood vessel there. And I think we were actually getting the muscle to adhere to the bone on that area, and that's certainly going to affect range of motion. It's going to affect the ability of the leg to move. So I would say probably the thing you need to figure out is if your dog's not using the leg, is it a pain issue or is it a mechanical issue? And one of the ways you can test is if your vet has a non-steroidal anti-inflammatory like Rimadyl or Pravacox or Deramax or one of those, go ahead and try your dog on a few days of it just to test and see whether or not it makes your dog better. If your dog is better, then it's obviously a pain issue. If the dog doesn't get better, then it's probably a mechanical problem, and for that situation, I would strongly recommend that you find a good physiotherapist who can help you break down that adhesion, that scar tissue, because it's now 2 years old adhesion, and an acupuncturist. Sometimes in those, I'll acupuncture those with vitamin B12, because in the 90s, the Germans did quite a bit of good research showing that B12 around scar tissue can actually help it soften, and then it's easier to break it down. And then I would actually start working on it from that perspective and get I think the structure is still not right. I think your dog is still crooked, and I think all the muscles and other things have to be fixed. Thanks.